So I think one of my favorite things we do here at Sarasota Vascular is our screening program. Often people will come in, it's actually a family member usually of a patient saying, hey, do you think I have this, or could I have carotid disease, or my mom had a stroke, or my dad had some sort of an aneurysm. There are kind of three things that we look at when it comes to the screening program. We first check the neck. We look at the carotid arteries. Those are the blood vessels that provide blood flow to the brain. If you have a tight narrowing in those, sometimes that can lead to a stroke, and that can be debilitating or deadly. The next thing we look at is the abdomen. We look at the abdominal aorta. We look for an aortic aneurysm. There are certain criteria we look at to figure out if it's large, or if it needs to be treated, or if it's just small and needs to be followed, or if it's just a normal aorta at a certain age, we don't have to worry about it thereafter. But not knowing is not the right answer. And then the last thing we look at is the overall amount of blood flow going down to the legs. And the way we do that is with a simple blood pressure check at the ankles and at the arm to compare the difference between the two. And that's called an ankle-brachial index. Ideally, it should be close to 100% or they're the same. Sometimes it's not, and then we help decide, is it a significant degree of blockage that we have to worry about? Do you have the ability to walk and function and heal a wound if need be? And so when we look at these three things, we're trying to prevent stroke and identify risk factors for stroke, evidence of an enlarged aorta or risk something that could be an instantly fatal thing if it ruptures. And we look at the ability to heal your leg wounds if you have them and to see what's causing leg pain either at night or during the day. The best part is all three of these tests are done in one setting very quickly and without any kind of invasive thing. No IVs, no blood draws. It's just ultrasounds. And one of the things that makes it even easier is if you're interested or you have more questions about this, you can go to sarasotavascular.com. We have a completely separate section of the website regarding vascular screening. You can read up more about it. You can fill out a form. You can register for it, and we can get you in as soon as possible to check for these things that could be putting you at risk for stroke, a ruptured aortic aneurysm, or the inability to heal a leg wound.